What psychological disorders may addiction cause or exacerbate? Addiction can lead to depression, loss of desire, burnout, disturbed sleep, feelings of guilt, isolation, and low energy. Sometimes symptoms of depression appear due to substance use or withdrawal. And sometimes depression is present before addiction and worsens with it. A realistic sentence for the patient. It's not strange that you feel empty after using, because your brain is being drained. Anxiety is not always a tense personality. Addiction can increase anxiety and create a cycle. Stress, then using substances to calm down, causes greater anxiety and leads to more use. Panic attacks, palpitations, sweating, and intense fear may occur, especially during withdrawal periods or with certain substances. Some substances may cause psychotic symptoms in some individuals. Severe paranoia, unrealistic thoughts, or disturbances in reality perception, and may increase the risk of psychosis in those with susceptibility risk factors. This is medically called substance-induced psychotic disorder. And when unusual symptoms appear in thinking or perception, this requires a quick medical evaluation, not blame. Addiction can cause symptoms of mania, impulsivity, or exacerbate an existing bipolar disorder, especially with stimulants or certain substances. Insomnia, interrupted sleep, nightmares, or uncomfortable sleep. Sleep is the first thing to be affected, and it is also the first key to recovery, because the brain does not calm down without stable sleep. In some cases, addiction may increase obsessions and compulsive thoughts or compulsive behaviors. Symptoms similar to those may appear in substance-induced disorders. Many patients complain, "My mind is not as it used to be. My concentration is weak. My memory is tired." These are called cognitive disorders and may gradually improve with cessation, treatment, and follow-up. In some types of withdrawal, severe confusion may occur that requires urgent medical intervention. The important thing here is, do not face withdrawal alone if the symptoms are strong. Why does this happen? Addiction reprograms the reward circuits in the brain and affects areas related to mood, anxiety, sleep, and decision-making. The psyche becomes more fragile, daily stress becomes heavier, and the return to substance becomes quicker. Message of reassurance. Does this mean I am lost? No. Having psychological symptoms along with addiction does not mean you are finished. It means there is a clear medical explanation and there is a clear path to treatment. And most importantly, the real treatment is not just stopping the substance, but treating the psychological roots: depression, anxiety, trauma, sleep, coping skills with stress. And this is what reduces relapse and stabilizes recovery. In Dr. Alakkad's program, we rely on a comprehensive treatment plan, precise psychological assessment, a psychological and behavioral treatment plan, relapse prevention support, and proper family involvement, along with other modern techniques in treatment, because recovery is not a one-day decision, but a path built step by step. Don't hesitate to request treatment via www.dr-alakkad.com. Direct WhatsApp +905 379 336844. Every day you delay treatment adds new pain, and every day you start, it shortens months of suffering.